Jürgen, thank you so much. First of all, I want to add my welcome to the commissioners of the Lancet report, to the other external advisory board members for the Global Mental Health Program here, and most of all, to all of you for being here to come together to discuss this landmark report and what's actually a call to action. I'm going to take you back to 1962 for a minute. In 1962, somebody named Thomas Kuhn published a wonderful and at the time groundbreaking book. I see some smiles, so some people know this one. It was called The Structure of Scientific Revolutions. And it compared what it characterized as the normal process for moving science forward by accumulating largely accepted facts and concepts with what happens in scientific revolutions, which is a paradigm shift, a complete shift in vision and in concept. And in fact, there was a wonderful line in that book that says, when paradigms change, the world itself changes with them. And it also made the point that those paradigm shifts were often driven by crisis. So this Lancet Commission report that we're here to discuss today points to the global burden of disease study that Chris just told you about as a transformative force in revealing the crisis of mental and substance use disorders and dementias. And all of that, of course, has been thrown into relief, as others have already said, by things like the opioid epidemic that we're experiencing here in the United States and by the growing prevalence of dementias with aging of populations. And this report also proposes a true paradigm shift, which they very humbly actually frame as reframing rather than a paradigm shift. But it provides this view that we should be thinking about mental health as foundational to achieve improvements in all aspects of health and in sustainable development. And therefore, this is a global public good. That's pretty different from the way we've been thinking about mental health, at least those of us outside. I'm an infectious disease internist by training, okay? I'm not a mental health, I'm not a psychiatrist, I'm not a mental health physician or clinician. But that's different from the way we've thought about this before. And this notion that this is a global public good has major implications for financing and for how we deal with mental health. I think as every clinician among us here has seen, mental health really shapes risk, adherence to treatment, retention in care, resilience and response to sequelae, and function. And that's across infectious diseases, kinds of things I do, non-communicable diseases, reproductive health, and the entire life cycle, as we're going to talk about today in the various sessions. The report also highlights that mental health is inextricably and reciprocally intertwined with sustainable development and with the Sustainable Development Goals. Things like reducing poverty and hunger and inequity, increasing education, decent work, economic growth. Again, that's not traditionally the way we've thought about where mental health fits in with things. And this paradigm shift actually changes how we should be thinking about who, where, when, and how we do mental health. So I very much look forward to our discussion today, and I hope that each of us will walk out of here with a new lens on global mental health and new insights about and readiness to respond to what I think is clearly a landmark call to action.